Hello, I'm Anthony Webber, Senior Lecturer and Program Leader for the Bachelor of Paramedic Science here at CQUniversity. I'd like to take this opportunity to thank you for letting me provide you with this presentation where we're looking at innovations in the paramedic practice here at CQUniversity. And the area I want to focus on today with this presentation is how we teach clinical procedural skills to our distance education students. So this is something that's integral for them to be work-ready graduates by being proficient in their skills application. But our challenge here at CQUniversity is how we go and teach the hands-on components of clinical skills to our students and giving them the opportunity to have the declarative as well as the procedural knowledge of these skills. So skills acquisition is required for two main purposes within our program. Obviously the first makes sense, it's to become proficient in skills application so the students are work ready when they go out in their clinical placement, and through their proficiency they are then graduate ready as advanced care paramedics for employment within Australian ambulance services. And the second component of our skills is allowing the students a chance to become competent in the use of our mannequins. Our high fidelity simulation mannequins unfortunately have some small pitfalls, which include areas where you would take a pulse on a human anatomically maybe out of place within the mannequins. When we take a blood pressure on a human, on a normal patient, we apply a sphygmometer, pump it up, take the blood pressure. Now physiologically we can give these parameters to the students, but there's some little intricacies. And for instance, with the blood pressure cuff, the students would have to attach a second tube to the mannequin so they can get that physiological reading. So it's important that we teach these small issues or small pitfalls in the mannequins to our students, so when they come to doing the high fidelity clinical scenarios, then they aren't put off by the difference in anatomy where you take pulses and blood pressures. So number one aspect is for them to become proficient, work and graduate ready. Secondly is for them to have an understanding of the workings of the mannequins so we can maintain the high fidelity within our scenarios. Now again, one of the challenges with teaching our distance education students the procedural skills is based around this old concept of see one, do one, teach one. And I think for our internal students we can certainly adapt to this, where on a regular basis they're seeing one, doing one, teaching one, but our distance education students aren't going to do this on a regular basis. So they need to see numerous, they need to practice many, and they need to teach one on their residential schools. And prior to their residential school, a fair bit of front loading that we're providing the students is seeing numerous skills being performed. And the way that we're doing this is through a innovative and exciting component of point of view camera use. So we are filming the lecturers doing the skill from a holistic point of view, but at the same time that skill is being performed and being filmed through a point of view camera. And at the end of this presentation I'll show you a short clip on one of the procedural skills that are being done, which was the intra-osseous injection, so you can see how the point of view camera has worked. So the students get a lot of front loading, all the skills, the 25 to 30 odd basic and advanced skills which is required as paramedic students. They are seeing this through Moodle and they can be repetitive in watching that video, and the hope is that they will continuously, repetitively watch the video. When they come to their residential school, then they will practice many, and we do this through the use of the clinical skills teaching model, which is a four-step process where as a lecturer I will perform the skill in a real-time process. The second stage is performing that skill again but with narration, so explaining or rationalising each step of the skill being performed. Thirdly, the skill that is being performed again by the lecturer, the narration is then being done by the students, so they will talk the lecturer through step by step with rationales and justifications for each step. And the fourth step is that skill then being taught to their peer, and that student will then go through the four-step method again to their peer, who will then follow that process through. So I think by being repetitive with our declarative and our procedure skills, this process of seeing numerous, practicing many and teaching one will put our students in a good stead where they are proficient in clinical skills. So just briefly, some of the partial human patient simulators and the high fidelity mannequins that we have at CQUniversity. We have torsos and mannequins which are used for CPR, defibrillation and transcutaneous pacing. They also have arm and leg models that teaches intraosseous intravenous access, which is inserting needles into the bone and into the veins, as well as intramuscular injections. We have head and lung models to teach intubation and airway rescue techniques, and obstetric phantom models that teaches basic and difficulty delivery. So this is our obstetric phantom model, where we're able to teach basic obstetric deliveries, as well as more advanced difficult deliveries such as breech delivery. This skills trainer can have inverted uterine and also can have postpartum hemorrhages. This is our advanced airway trainers, so the students can perform all basic and advanced airway techniques and learn to practice rescue airway techniques also, where the advanced technique isn't working effectively, so they need to intervene with basic airway management. Just another form of our airway mannequins or our skill trainers, and this one is where the students can see the airway adjuncts where they fit within the upper anatomy. And again, our arm skills trainers, which we can use for intravenous access, intraosseous injections or intramuscular injection. Our patient simulators, we have the SIM technology for our high fidelity simulation mannequins, and the lifelike controlled mannequins, which are controlled through a computer system, where we have interactive software which controls the scenarios, controls the physiological changes through the mannequins, and also controls the debriefing process, which is probably the most important part of simulation. So 3G SimMan, as you can see slightly around his lips, he has a cyanosis, so he's blue. He can sweat, he can bleed from the ears and nose, he can vomit, he can have frothy sputum. He has all the physiological vital signs that you'd expect, such as pulse rates, respiratory rate, blood pressures, heart sounds, lung sounds, bowel sounds. He can have arterial or venous bleeding. He can go into a seizure. His eyes can open, close, responding to the level of consciousness we require. His pupils can change sizes. They can be equal, unequal, dilated, pinpoint. We talk through SimMan, so when the students ask the history, such as the chest pain, we can provide the answers by talking through SimMan, so it's as realistic as we possibly can with high fidelity mannequins. And as you can see with the right side of his arm, there's a cannula which is already in situ, and this is connected to a computer system within his arm. When the students go to administer a drug, then a chip is applied to the syringe. As soon as they get to about 10 centimetres away from his arm, it registers what drug is being used, and when the students actually administer the volume of drug, it registers the volume. So it will react to the correct drug and the correct volume that's being administered. Now this is our Sim Newbie. Again, physiologically does everything that is expected of a newborn baby. It can have motion, it can be limp or flaccid, it can go into a seizure, it can become cyanosed, and again it has all the vital sign parameters that you require. This is our medium fidelity mannequins, which is our this is our trauma module of our advanced life support mannequin. We can apply any trauma module to him that we like, and in this case the poor bugger, he has a foreign body through his head, he has a nosebleed, he has lacerations to his face, he has bowel evisceration. On his left foot you can see a slight burn there, and on his right foot you can see an amputated toe. So we can alter the scenario by altering the trauma module as required. So the point of view cameras, this is the unique, innovative way that we're wanting to teach our students about clinical skills, so we can give them all the declarative knowledge in the world, but when they're actually seeing the hands-on aspect of it, if they're not here on a daily basis, it becomes difficult. And we think through the point of view camera technology that we are able to provide the students with the best opportunity to view the skills being done, and they can be repetitive in watching that skill being performed as front-loading information prior to coming to their residential school. So I'll just like to put on a couple minute presentation now of the point of view camera. Thank you for your time in reviewing my slides, and I'm happy to take any emails or phone calls any time to discuss this further. So thank you.
Right, team, this skill is the intraosseous injection. We must have our intraosseous gel, our intraosseous needle, and also our intraosseous giving set. The idea is to find the tibial tuberosity, come down 3 fingers from there, and that is our insertion point. We insert the needle on the drill, hold it firm, take off the needle point. We then come down on a 90-degree angle, pierce the skin and drill. Taking out the needle, leaving the catheter in situ. We then attach the intraosseous giving set, and with our intravenous fluid that we've already had prepared, we then attach the lure lock to the IO, and we turn the giving set on, allowing for fluid to run through.